Good evening. I am Carlos Frank, the Ogden Professor of Fundamental Physics at Durham University, and I am also the chair of the Royal Society's Public Engagement Committee. Thanks so much for joining us this evening here on the Royal Society's YouTube channel. Of course, we're here tonight to celebrate the 2020 Michael Faraday Prize, which has been awarded to Professor David Spiegelhalter. Now, this prize is given annually to a scientist, mathematician, or engineer who is not only outstanding in their discipline, but also able to communicate scientific ideas to a public audience in a clear and engaging way. The award, of course, is named after Michael Faraday, fellow of the Royal Society, the very influential 19th century scientist who discovered, amongst other things, electromagnetism. Not only was Faraday a really brilliant scientist, but he was also an enthusiastic and committed public communicator of science. So much so that in the 1820s, he founded the Christmas lectures at the Royal Institution, which were aimed at young people. And of course, these lectures continue to the present day, 200 years later. Faraday is famous for many things. Amongst them, a reply he gave to the then Chancellor of the Exchequer, William Gladstone, who once came up to him and asked him, Mr. Faraday, but what is the use of this phenomenon that you have discovered, electricity? And Faraday is reputed to have replied, well, I don't know, sir, but one day you may tax it. Now, David can count himself amongst a list of exceptional scientists and communicators, including Martin Polyakov, the winner last year, Daniele George, Martin Rees, David Attenborough, Brian Cox, and Jocelyn Bell Burnell. Now, whilst normally we usually would be celebrating this evening in London at the home of the Royal Society, perhaps with a glass of something sparkling in hand, tonight we're at least able to come together virtually, as it were, from all over the world to join David as he discusses the absolute vital importance of clear and reliable communication of numbers and statistics in these strange times of the COVID-19 pandemic. I very much hope you will enjoy the discussion, and I will now hand over to our wonderful host, Tim Harford, broadcaster, journalist, and presenter of one of my absolutely favorite radio programs, More or Less. Tim.
Good evening, everyone, and welcome to the virtual Royal Society. I think we have a wonderful hour in prospect, timely discussion of the statistics surrounding COVID, and more importantly, a chance to enjoy the wit and wisdom of Professor David Spiegelhalter, who I will introduce properly in a moment. But before I do, I should tell you who I am. My name is Tim Harford. I'm a Financial Times columnist, the presenter of the BBC radio show More or Less, and the writer of a new book called How to Make the World Add Up. And it is my pleasure not only to ask questions of Sir David, but also to give you all this bump. So excuse me a second, I'm going to read you the bump because it's important. First, if you want to send questions, we can take questions via Slido. I'm going to do my very best to understand how Slido works. The Slido link is in the video description. The access code for this evening is #Z999, which feels like it should be the name of Doctor Who's dog and somehow isn't. #Z999. We're probably not going to be able to cover all the questions. We'll do our best, but if your question is pithy and insightful and brief, that will maximize the chance that I actually get to put it to Sir David. Also important, there is live captioning this evening. And if you would like to see the live captions, click the subtitles or the closed captions button in the bar at the bottom of this video. And if you want to tweet during this event, I actually discourage tweeting while listening to David. I think you should just soak up all the wisdom, but you can tweet if you want. And the hashtag is COVID Science. So look, I should say, should say a few words about David Spiegelhalter. He is the chair of the Winton Centre at Cambridge University. He is an amazing communicator about risk and about statistics, long-time friend of More or Less, regular guest, and I think the nation's favourite statistician. He is, he's a worthy winner of the Faraday Prize. I have to say, I actually realised I never quite asked why he won the Faraday Prize, which is given for science communication, because it's just so obvious that, of course, he would win it. Apparently, it's just basically for being so awesome for the last sort of several decades. I should say, David told me I shouldn't say this, but I'm going to say it anyway. He's written an amazing book, which is called The Art of Statistics. Terrific book. You should get it as a Christmas present for all of your friends. And on the back of the book, none other than some bloke called Tim Harford said, David Spiegelhalter is probably the greatest living statistical communicator. It must be true because I said it on a book. I still believe it. It's my pleasure to introduce Sir David Spiegelhalter. Hello, David. Welcome. How are you?
Hi, Tim. Great pleasure to be here.
So just give us the potted history of how you got to be David Spiegelhalter, how you got to be this voice on our television screens explaining COVID risk. What's the history of all of that?
Okay, well, before going into that, I should just say, about getting this Faraday Prize, because it is an extraordinary honor and privilege to get this. When I, look at the people who've won it before, David Attenborough and Brian Cox and Jim Al-Khalili and Marcus Dissertoy and loads of others I'm not going to mention, but they're all the people that I really look up to when it comes to science communication. So I think it's really nice to, I'm really delighted to get it. I'm very sorry I can't be there, and have a reception, all that sort of thing. Royal Society did send me a nice little hamper, little, Red Riding Hood hamper, which I haven't opened yet. I want to see what's in there. So it's really delightful to be here. And in exchange for plugging my book, can I mention that after you've bought my book, perhaps for Christmas, you might want to get Tim Harford's How to Make the World Add Up. Honestly, this is so incestuous, it's untrue, because I've written on the back of his book as well, saying how wonderful it is. So we've got that over with now. I'm glad that's all pulled. Okay,
you're too kind. This is supposed to be an evening about you, David.
No. It's fun. Okay, so how did I get here? I started off doing maths at university, and then I did pure maths, and it got too difficult, so I changed to statistics, and I found I liked it. And I've carried on doing statistics as a sort of academic way for quite a long time, but getting more and more involved in really practical problems, like the public inquiry into the Bristol babies that died, and also public inquiry into Harold Shipman, and all those sorts of things just gave me more and more of an interest of how data is used in society. And then in 2007, I was incredibly lucky that David Harding of Winton Capital Management endowed a chair at Cambridge University, the Professor for the Public Understanding of Risk, and I got that. And I retired at the beginning of last year. But since then, all that time, I've been philanthropically funded by this endowment to work on communication. And the people at the BBC have been fantastically good at having BBC4 documentaries that are fronted by academics rather than celebrities. So I've done those, and it's been a delight to be able to change career, even at my advanced age, into essentially communication almost as a full-time job. Although, I do, I still do some research work, but most of my research now is with psychologists, because David Harding, again, funded a whole Winton Centre for risk and evidence communication, which now I work with in Cambridge. And that's mainly psychologists and communication professionals, fantastic group of people who have taught me so much, and that statistics is not the only thing in the world. Amazing.
And there is a podcast that you present called
yes.
Risky Talk.
Risky Talk.
It's very good, but you've gone quite quiet recently. It's almost as though you've been quite busy. I encourage everyone to subscribe to Risky Talks. I'm sure it will be back. But,
we got some new ones. We got some new ones coming out. Ilan Goodman produces it and does a brilliant job. And Risky Talk, it's about talking about risk, but it's also how you talk about risk, because that's what we sort of work on. Is just the risk communication in all different areas. So I do recommend subscribe to Risky Talk.
Yeah, I seem to remember it was basically climate science, COVID, goodness me. There's a whole variety of things that we will, once, eventually we'll be able to talk about when this is all over. But I mean, we should talk about the statistics and the communication of statistics during this crisis. Tell us about what you've been doing.
Yeah, okay. Well, can I share my screen, show some slides about what I've been up to? So I'm going to do that. So that is, okay, so I'm supposed to be giving a sort of lecture. So there's my lecture. So that's me. And let's see if I can, oh yeah, sorry. I did want to show my colleagues at the Winton Centre. This is from a little while ago, so the colleagues have changed a bit. But as I said, this is a great group of people that I work with now. One of the things in my book, I start by saying all the time, and I just repeat this all the time, data does not speak for itself. And this is a lovely quote from Nate Silver's book, The Signal of the Noise. The numbers have no way of speaking for themselves. We speak for them. We imbue them with meaning. And that has been so true within the COVID crisis, that there's been masses of numbers around, but what we make of them depends on the story that we're telling, the narrative in which they're embedded. And we can make it look dangerous, we can make it look safe, we can make the numbers look big, we can make the numbers look small, depending on how we treat them. Okay, so I've been trying to work my way through this, and it's been a very busy time, of course, for statisticians. As I'm going to say, I think the statisticians working for the big organizations, such as the Office for National Statistics and PHE, mainly done an amazing job in getting the stats out. But there has been huge demand from the media for comments from experts. And a lot of the experts are working so hard supporting SAGE and working for these organizations, and are reluctant or just don't want to or can't get out and talk to the media. So it's been dumped on me and a number of others to do a lot of media work. And I've been doing weekly press briefings during the peak of the epidemic with the Science Media Centre. And I should say most journalists have really acted rather well, partly because they have to, because they've got to be nice to us because they need us so much. Something I do want to say is it is quite tricky to remain non-aligned, because people always wonder, are you for lockdown or against lockdown? So I'm not going to say. I don't think I should be recommending policies at all. That's not my job. And there's a constant need to say, it's not my job, not what I know about. I have refined my skills in just stopping interviewers and saying, I don't talk about, I don't know about epidemic models. I don't talk about what policies should be enacted. So that has been something I've had to learn. I have had too much attention sometimes. I wrote this column some time ago in The Guardian about saying we should be very careful about doing sort of Eurovision comparisons between European countries. And then this is back in May, Boris Johnson mentioned me in parliamentary questions saying we shouldn't make any international comparisons. And urged by some colleagues, I tried to repudiate that in a tweet to say, polite request to the Prime Minister, don't say, I didn't mean we can't make any comparisons. What I was talking about is we shouldn't be talking about who's first, second, and third. Of course, we should try to learn from other countries that have done a lot better. And that was my one viral tweet with 10,000 retweets. And then, of course, I got mentioned by Keir Starmer in parliamentary questions, against Boris Johnson. At this point, I thought it's time to start having a lower profile. So this is not the sort of situation I want to find myself in as a statistician. Part of the communication that I have been doing is to try to translate the kind of risks of COVID into, to try to embed it in a story that might be easier to grasp. It's incredibly difficult to grasp, I think, the risks of COVID. So I wrote this paper in the British Medical Journal on trying to use the normal risks we face as comparators. And one of the first things you have to do is to distinguish what are the risks. You've got the risk of catching it. You've got the risks of dying if you catch it. And then you've got the risks of both together, of both catching it and then dying. And those are the ones that are really quite easy to estimate, because we just look at how many people in each part of the population, how many different people in age group have died of COVID over the peak of the epidemic. And when we do that, I mean, I'm sorry about this rather complicated graph for those who like graphs, This is a bit like one of those like one of those press briefing graphs where you put it up and then whip it off immediately very quickly. But I'm going to try to do it a bit better than that. The crucial thing, if we look on this right-hand side, it shows the risk of dying from COVID over the peak of the epidemic with age just rose massively, exponential increase in the risk of dying from COVID. And roughly speaking, for every year that you get older, the risk was increasing by about 12 to 13%. Age is the overwhelmingly strongest risk factor for COVID, even stronger than ethnicity, which is important, stronger than sex, which is important, stronger than most diseases as well. It's age. And I'm always amazed that it is not talked about more, that people should be, the younger people should be really trying to protect anybody like my age. I'm 67, keep away from me. I'm at higher risk, and I'm at 100 times the risk of somebody who's 27. So just keep away from me and keep away from your granny if you can. So, and the risk is therefore doubling every 5 to 6 years, massive gradient. If we look at it on a log scale, we can see that, people in their 90s had about a 2% chance of dying. 2% of all people in their 90s died over the 16 weeks of the peak of the epidemic. But down here for these kids is 1 in a million or so. So this is a massive, less than 1 in a million chance of death. A massive difference in age. And I was trying to think of a way to translate this. And I thought, well, people over 50, very roughly speaking, over the peak of the epidemic, the 16 weeks of the epidemic, it was like we experienced about 5 weeks extra normal risk, because this is the normal risk we face of dying there over the year. And this was less than this. So it's about 5 weeks extra. It's almost like living through the peak of the epidemic, anyone over 50, instead of experiencing 12 months of risk during this year, they experienced about 13 months of risk during the year. I thought this was a good analogy. It has failed dismally. Nobody likes it. Nobody's picked it up. Okay, so what about another analogy that I was using back in March about the chance of dying if you catch COVID? And I was on More or Less back in March, describing this analysis. This is the first estimates made by the Imperial Group, not based on Chinese data and Diamond Princess data, on the risk of dying if you catch COVID. And varying, this is out of 10,000, varying, over 10% up here for the elderly, down to a tiny figure, 1 in 5,000 or so, 1 in 50,000 for children. And what I noticed is that is very similar to the annual risk of dying anyway of something else. So I was on More or Less describing this, and I said the risk of, if you caught COVID, was similar to the risk of dying this year from other causes. Another terrible failure in communication, because this was hugely misinterpreted. The BBC very nicely reproduced this graph, and then Katie Hopkins, and here's the BBC's reproduction of my graph, showing that the risk of dying from COVID was very similar to the risk of dying from something else this year. And dear Katie Hopkins, before she was banned from Twitter, tweeted out to her 1 million Twitter followers, fact-based tweet, corona deaths are not outpacing what is normal or usual, and blaming me for this. So she was interpreting this as meaning that the coronavirus, if you caught it, didn't add at all to your normal risk of dying this year. And I thought, no, they're the same magnitude. It doesn't mean they're the same thing. In fact, what I should have said, of course, is if you catch the coronavirus, it doubles your risk of dying this year. And I should have been clear about that right from the beginning. Because what happened, the Sun had the headline, your risk of dying is no different this year, despite coronavirus pandemic, says expert. There's me. Oh, I didn't say that. It's the last thing I think. So that's what happened. And of course, I complained to the Sun, and I've always, many times, the last one was just last week, I complained to newspapers about their headlines, and they changed them. I mean, I recommend to anyone else who gets the bad headline, complain and complain immediately. They do change them online anyway. And they changed it to something slightly better. Your risk of dying from corona is roughly the same as your annual risk, says expert. So that was slightly better. So what's interesting, I think, my final slide on this first part is to, we might ask, well, what's happened? What about this infection fatality rate now? That's the risk of dying if you catch it. What is the latest estimate? The latest estimate from the same group, that's the latest estimate. I mean, it's quite extraordinary. It goes right through the middle. So according to them, this is based on many countries, so this is hundreds of thousands of COVID deaths, analyzing those, you come to exactly the same conclusion, that the average risk of dying if you catch COVID is the average risk of dying this year of something else. So I think this is it was a very good, it's the one thing I have got right out of everything else I've got wrong over this pandemic, was this claim back in March. Of course, actually, this is in the first wave. The risk of dying if you get it now in the second wave is reduced. I'm not going to say, probably between 30% and reduction to 50% reduction of what it was before. So that line has moved downwards a bit. So with that, I'm going to stop. I'm going to stop showing my screen and go back to chatting to Tim.
Thank you,
Well, that's what I've been up. That's what I've been up to, I suppose. Yeah.
Yeah. Well, you've been up to plenty of things, and thanks for sharing some of them with us. Actually, I was quite struck by that last pair of graphs. This isn't really a risk communication point, but it's striking how little the Verity et al. Estimate changed. That basically they seem to get it right first time around. It's impressive.
It is extraordinary, and that was based on very thin data, essentially from China and from, as I said, from cruise ships and everything like that. It was a wonderful piece of work. It was in that report from March from Imperial College that's received such a lot of criticism and comment, and that was in there, and it's a fantastic bit of work. Yeah,
I mean, a lot of people criticize that report. I'm not sure how many people have read it. For my money, it's quite striking. They didn't get everything right, but it is quite striking how much they did get right at a very early cut at the data.
And they were very. We can talk a bit about uncertainty later, but they were very clear about the fact that they were making projections with a lot of uncertainty and under a lot of different scenarios. But maybe we could get back later to this whole business of projections and scenarios and their communication.
Well, absolutely. Well, I had all kinds of questions for you, but I made the mistake of looking at Slido, and I've now had to throw all my questions out, because actually the questions that are coming in from people online are, I think, very pertinent. There's a good one about uncertainty, but which we'll come to. But
yeah.
Let me start with one from Sue Rosario, who asks, after the awful visual aids which accompanied the presentation by the Prime Minister and his advisors on the 31st of October, what's the best piece of advice you can offer to presenters of statistical information when using visuals? Or maybe when not using visuals, as you wish.
That's interesting. Well, I'll come back to that. I've got some more slides about what others have been doing. And I'll come back and criticize those or say how good they were later on.
Yeah, well, so I want to let you do that then. So let me ask you a different question and then come back to...
Yeah, okay. We could come back to that. But I mean, I think that I'm not an expert on visual design. Lots of people have written extremely good books on visualizations. And I think, you have to follow the advice that's been given. I could say Alberto Cairo, I think, is the guy I always would go to look at visualizations. But one of the crucial things, of course, is to test them. And I failed in that visualization drawing the dots and showing they run along the line. I thought it was brilliant. I was very impressed by it, but it completely failed in its communication message most of the time. So all the risk communication work we do in the visualization or the communication work we do, we say there's no absolutely correct way to do anything. The crucial thing is to work out what you're trying to communicate and then test it.
But what about, how do you cope with the fact that, there's a lot of motivated reasoning out there. A lot of people who are very keen to reach a certain conclusion. And I don't know why Katie Hopkins misinterpreted what you said. Maybe she didn't understand. Maybe she was strongly motivated to not understand. I don't know.
Well, one of the
people working hard to reach a particular conclusion and to twist the data in a certain way. So how do you deal with that?
Well, as I say, I started off by saying the numbers don't speak for themselves, and most graphics don't speak for themselves either. So I've learned the trick that other people have recommended is that above the graphic, when you put it, you slap on a big headline saying what the main message from it is. So you make sure that's an integral part of the graphic that people can't take out later on. So it's actually part of the graphic, not just in the legend or the text or something around it. So you actually really help people in the interpretation. I think it's only fair to do that for general audiences.
Clearly, these things can be can be manipulated. The graphic can be rebased or retitled, but you'd have to then work harder to do that. It's harder to accidentally misinterpret.
Yeah. I mean, you've got to be, you've got to be quite confident that this is the message, and of course, a good visualization, allows people to learn more from it than your just headline figure, and take more from it. You should always be trying to provide, allow people almost to make up their own mind that this is a convincing a claim that you're making on the basis of the visualization. I always go back to Honora Neal, and she says the business about transparent communication, intelligent transparency, is that, okay, I'm going to go through the checklist that I always do, sorry. So Honora Neal, great philosopher of, and expert on trust, I'll come back to her later. She always says, if you're trying to communicate about data, then you've got to do four things. You've got to make it accessible. People have got to be able to get at it. And people have actually, that's got very good during this crisis. You can download, a lot of data from the Office for National Statistics and Public Health England, and even, the stuff that's delivered in the briefings. The spreadsheets with that data generally are available either at the time or very soon afterwards. It's got to be accessible. It's got to be comprehensible. People have got to be able to understand it, and you've got to be able to test it. It's got to be usable in the sense that it answers people's concerns. But her final one is it's got to be accessible. So people should be able to check your working if they want. Not everybody will do that. Most people will take things on trust. But if you show some data and you make a claim, you've got to be able to back it up. People have to be able to check your working if they want.
I mean, this, I think, puts asks a lot of the ordinary citizen, or potentially asks a lot of the ordinary citizen. And I've got a question here from Mark Moffat, who says, how can the average citizen access the statistical skill necessary to make rational decisions? I mean, we seem to be relying quite a lot. Yes.
What else can I say? No, I think this is a big issue, and I'm on, go on and on about the need for increased data literacy in the population. And I think everyone agrees this COVID crisis has demonstrated the enormous need for citizenry to be well informed, because in the end, all this, people have to feel that the policies that are being enacted are justified by the evidence. And so I do think that this is a vital concern. And the ways in which that's done are enormous. I mean, I think it should be a much more integral part of schools' education. It should be part of, I think a lot of science communication, that can help. Programs like More or Less do a fantastic job at providing that. And we should be just helping people understand work all the time. And I'll come on to that, what I mean by trustworthy communication a bit later. But I do think this crisis has really illustrated the importance of this. Oh, and another fantastic bit of research that my colleagues have been doing. I've been testing people's resilience against misinformation about COVID. And the biggest predictor of people's resilience to misinformation is numeracy. Now, I can't, being a good statistician, I can't claim causation there. I can't claim that if people's numeracy skills were bigger, that would make them more resilient. That would be a bit much. But I'd love to think that but it is a strong association. And it is. So I think that, again, we're in an age of misinformation. We're going to see even more when the vaccines start being rolled out. And we have to do what we can to buffer people from that.
I was quite struck by that study, actually. I noticed that. Now, to be honest, it surprised me. It challenged my preconceptions, because my feeling has been that a lot of the conclusions we reach they're political, they're emotional, they're what our friends tell us, they're what we want to think because we're trying to win an argument. Yep. All of these other things that govern whether we fall prey to misinformation or not. But it's quite interesting that actually the story your colleagues were telling is maybe it is as simple as, if you can add up, you'll do better.
I do find it very encouraging. I mean, there's obviously a whole area of tribalism in the sense of the way people have. I mean, I don't want to start talking about the full range of skeptics about COVID and things like that. But there's a strong voice. We hear. I think there's a lot of misinformation out there, and clearly there's a tribe that is attracted around that kind of voice, and especially because there is some media that support that voice. And so I do think, I find it encouraging that it's not just pure tribalism.
Yeah, no, it is encouraging. Now, David, you said that it was important that people were well served and were given information that they could trust and that they could understand. And you've been promising to show us more stuff. So
yeah, can I show you?
So how has everybody who isn't David Spiegelhalter been doing?
Yeah, can I show you some stuff I like and I don't like?
Sure.
Yeah, just okay. So I'm going to share my screen again and hope this works. So okay, so here we go again. Yeah, how have others been communicating? And of course, more or less has done a fantastic job in all of this, and of course they have. But I'd like to just point to the work of the Office for National Statistics, and I might also obviously admit to a conflict of interest here, is that halfway through the epidemic, I was made a non-executive director of the UK Statistics Authority, which oversees the work of the Office for National Statistics. So of course I would say they're doing great work, wouldn't I? But this is the data that just came out on Tuesday, showing the progress of the epidemic. Nice clear illustration of the COVID deaths, the non-COVID deaths, the 5-year average. This is registered deaths, so it dips up and down according to bank holidays. And if you just blow up the last few weeks, it shows very nicely, in fact, that deaths have been going along, non-COVID deaths are roughly going along at the 5-year average, slightly below. And so essentially all the excess, the growing excess now, is from COVID deaths. But all is not normal. The next figure, I think, is terribly important. And this is the one I've been banging on about this for months and months, and I still get very upset about it, that not enough attention is being paid to where people are dying. If you look at this as the number of excess deaths, a big spike in hospitals, and then a deficit in excess deaths during the summer. Big spike in excess deaths at care homes. But crucially, look at what's happening at people in homes. Now, normally about 3,000, 2,000 and something people die in their home each week. But this has been running at about 600-700 now, nearly 1,000 extra deaths occurring at home every week. And this happened throughout the summer and shows no sign of changing at all. This just seems to be a new way of life, that about 35% extra home deaths are happening. So 1 in 3 more, a third more people are dying at home than normal. Very few of them are COVID. The crucial, what's the quality of these deaths? What's the end of life care that these people are receiving? If it's good, then maybe that's fine. People prefer to die at home rather than in a hospital or in an institution. But maybe it's not, and maybe some of these people might have lived longer had they gone to hospital. I think this is such an important issue that has not received sufficient attention. But a nice graphic again from ONS. I go to the Public Health England dashboard, which was awful when it started months ago, absolutely terrible, and now it's got really good. I like the fact that when they plot this is from the data from just an hour ago. When they plot the cases, the new cases, they do it by specimen date, not how many are reported each day. I get so fed up with the fact that the media, all they do is report how many new cases were reported each day, which goes up and down depending. It's always terribly low on Sundays and Mondays. There's a big spike on Tuesdays. It's just ridiculous. But if we look at the actual day of specimens, we can see, basically a leveling off, or a slow increase still between 20 and 25,000 positive cases a day. That represents about 50 to 55,000 new cases each day, because less than half of people are actually tested, testing positive. Patients admitted to hospital, again leveling off at about 1,500 a day, about half the peak. But the crucial thing is leveling off, and what might happen to that over the whole of the winter. If we look at deaths, the top line of this shows the fact that, what is a COVID death? There's at least 4 definitions from a COVID death, so I could go through. The Public Health England now focus on deaths within 28 days of positive deaths, after their disastrous use of not having a time limit at all, which meant that once somebody tested positive for COVID, if they ever died of anything, ever, in the future, that would count as a COVID death. Now it's 28 days, which actually reduces it a bit too much because some people might still live beyond 28 days and then die. But best of all is the deaths with COVID-19 on the death certificate, which comes from the Office for National Statistics. And that's, although people have been going on about, oh, we've passed 50,000 deaths. Well, no, we haven't. We went past that months ago. We're at nearly 62,000 COVID deaths on the death certificate, and quite possibly more. There'll be more than that. Deaths again going up to about 300 a day now leveling off. Okay, so I think that's quite good presentation. The other good source I find is Public Health England Weekly Surveillance Report. This is today's. It came out this afternoon. This is extraordinary. Look at this. Is the number of hospital admissions with COVID in the different age group. This is 85 plus, and they are showing a steep and increasing number in hospital admissions for COVID. Fortunately, leveling off for the younger groups. And this is hospital admissions for flu. And you think, oh, this is quite low compared with that. Look at the scale. That goes up to 2 per 100,000. So this whole graph fits down here. There are essentially no flu, admissions for flu at the moment. Now it is quite early on in the flu season, but I don't like making predictions at all, but I would like to predict there's going to be almost no serious flu this winter. And I don't think we have to have any mysterious reasons for that. The measures that are being taken even before lockdown at tier 1, the distancing that has taken place, which we've all got used to, I think is sufficient to cut down much of the transmission of flu. So we're not seeing any flu, which is good, because we wouldn't want to have both of those at the same time. Okay, not everything is good. I mean, this was a total disaster. This was shown at the briefing last Saturday, which was brought forward because this graph was leaked by somebody, persons unknown to the media. So it appeared in the BBC on Thursday, on the Friday. So then it was used in the briefing on Saturday. And no matter how many times they can say these are scenarios and not predictions or forecasts, everyone focused on this scenario, which ended up to 4,000 deaths a day. It's a massive total. And the point is, these were hopelessly out of date, even by last Saturday, or no, Saturday before last, when they were shown on October the 31st. The Cambridge group that produced that had produced it a month earlier, and based on just one scenario. And these are worst case scenarios. This is assuming we don't do anything. We just let let the virus go. We're not going to do any changes in policy or behavior. So these are worst case scenarios under assumptions, which were shown to be untrue even by the time this was being shown. Cambridge had revised its model twice and reduced this right down. So why this was shown, I just think it is not good at all, and just allows all the skeptics to pick on that. Anura Neil, again, my hero, said that she's an expert on trust. Her Reith lectures on trust still deserve rereading, even though they're 20 years old. She says that we shouldn't try to be trusted. He says we should try to demonstrate trustworthiness. Trustworthy communication of statistics is a vital component. The Code of Practice for Statistics, which the Government Statistical Service runs under, puts trustworthiness as its #1 pillar. It's such a good thing. You have to ask all the time, is this trustworthy communication? And you may have seen this before. I'm sorry if I'm repeating this, but this was my little diatribe I did back in May about the briefings. And I'm sorry if you've seen this before.
They're now very familiar with these daily press briefings. How well are they working, do you think?
Well, I watched yesterday's, and frankly, I found it completely embarrassing. We get told lots of big numbers, imprecise numbers of tests being done, 96,878. Well, that's not how many were done yesterday. That includes people that were posted out, tests that were posted out. We're told 31,587 people have died. No, they haven't. It's far more than that. So I think this is, actually not trustworthy communication of statistics. And it's such a missed opportunity. There's the public out there who are broadly very supportive of the measures. They're hungry for details, for facts, for genuine information, and yet they get fed this, what I call number theatre, which seems to be coordinated really much more by, a number 10 communications team rather than genuinely trying to inform people about what's going on. I just wish that the data was being brought together and presented by people who really knew its strengths and limitations and could treat the audience with some respect.
They're now very familiar with these daily press briefings.
Okay, so that actually got me on Gogglebox, for heaven's sakes. So that was my one real diatribe. I then tried to avoid doing that again. But part of demonstrating trustworthiness, as we've already mentioned, is admitting uncertainty about what we know. And I'm obsessed, like many statisticians are, with acknowledging uncertainty. I mean, and that could just be putting a range about a number, or it could be admitting that we just don't understand what's going on. Our evidence isn't that good. And this second one is something I'd really like to emphasize. Let's look at some of the communication that's being done, again, rather openness, about estimating R, the magic number, the average number of people that each person might infect, will infect. Now, R, there's 8 different groups around the country estimating R, which I think is extremely good to have multiple competing models producing R. And so here we see a little while ago 8 different estimates of R with intervals around them, with their uncertainty intervals around them. Interestingly, these are estimating the same quantity using essentially the same data. They've got access to the same data. Some of these are very precise intervals, but they don't overlap. It's a lot of they cannot all be right. So this is precision rather than accuracy. Actually, they're all broadly giving the same picture. So from a practical perspective, they're not that different. But what's absolutely crucial is that on the whole, they're far too confident. And that's because the estimates of precision that these models are delivering are based on assuming the model is correct. But we know the model is wrong. All statistical models are wrong, generally because they're too simple, and we just don't know how this process is actually working in society. So we go back to the classic phrase, all models are wrong, but some are useful. So I'd be very, very cautious. It's just as well, it's not just one group estimating this. So very, very cautious about taking margins of error on face value, because they are generally, contingent on assuming your assumptions are correct. And the one thing we know is your assumptions aren't correct. What many people I know have been arguing for is almost sort of star ratings on quality or strength of evidence for effectiveness of policies. This is already established by the UK What Works centres, which I think are the envy of the world. I think they're brilliant. For the Education Endowment Foundation, for example, reviews all the evidence about the effectiveness of interventions in education. And they produce a kind of toolkit like that. Isn't this lovely? And they give, it's like TripAdvisor. They'll give star ratings for how much it costs, what its impact might be, and how good the evidence is. So if you look at aspiration interventions, the second one down, we find it's fairly expensive. It doesn't seem to work, 0 impact. And the evidence is rubbish anyway. So maybe we shouldn't do that one. But if we look down the bottom at collaborative learning, it's fairly cheap. There's quite good impact, up to 5 months of extra educational gain. And the evidence is pretty good, 4 padlocks. And we found in our research, our team have found in our research that audiences, general public audiences, really notice quality of evidence. They take notice of this. Now, SAGE have been doing this in their recommendations. There's a great document where they summarize the potential impact of different interventions on R. And so, for example, they say wearing face coverings outdoors, very low impact on community transmission, high confidence. In other words, there's no point in wearing face masks outdoors. And there's good, and they're confident about that conclusion. Closure of places of worship community centers, well, it might reduce R by up to 0.1, difficult to estimate, only moderate confidence in that. So they give a sort of range between 0 and 0.1 of the effectiveness, but they're not even really confident about that either. So I think this is extremely good communication. You can give a range and also your confidence in your analysis. So I deeply recommend these ideas. So I'm going to finish off now. This is my diatribe. I think data literacy is a vital skill in modern life. COVID crisis has made this even clearer, and statisticians have shown themselves to be deeply wonderful people. But of course, I would say that, wouldn't I?
Thank you, David. I want to hold on that question of uncertainty for a moment, partly because I find it fascinating, partly because our most popular question on Slido is on the subject. It's from David Fox. I'm going to ask his question, but I'm going to tweak it myself. So he asks, is it more important for a statistician to communicate the conclusions or to communicate the degree of uncertainty associated with conclusions? It's a great question.
I could have, thank you for, sorry, who was that? What a fantastic
That was David Fox. David Fox.
They're equally important. They go together, and it's a bit like I said about the graphic. They shouldn't be separable, in that, you know, in a way the claim and your confidence in the claim should be absolutely strongly interlinked. And the way to do that, I believe, is as I'm trying to demonstrate, is first of all, if you're trying to estimate a quantity, give a range. And our research has shown that if you do give a range, there's no reduction in trust in the source. You do not have to give a single number. The source is trusted just as much if you can give a range. Unapologetic uncertainty is what we call it. And actually giving a range without even giving a central number, I think is even nicer, because it stops the media fixating on the number, because the media otherwise will ditch the range and only use the single number. So I think just giving a range is a good idea. But then we've seen these ranges are not necessarily very reliable. So you should also state your confidence in your whole analysis, your whole understanding of the process, your statistical modeling. And many people, this has been being done in medicine with the grade scale for years, and is deeply established. And so I don't believe it's not a choice of one or the other. They should be absolutely linked together.
But I worry that there's a risk that uncertainty can be weaponized. Something that I've looked at myself, and others have looked at, goes back to the tobacco industry, who were very clever when the evidence on smoking and cancer came out. They would go, well, you know, it's not certain, it's complicated, scientists disagree, all of which is true. The same thing then gets said about climate science. So how do you avoid, when you're expressing uncertainty, how do you avoid that being seized upon by people who go, well, look, you know, these boffins, they don't agree, they don't know what they're talking about.
They're always changing their mind. So this is the merchants of doubt argument, that's how the tobacco industry countered the claims about lung cancer or whatever, was not by directly saying they're wrong, just by constantly introducing uncertainty and building on that. And no, it's a very important point, because it's happened in climate science, and it has happened in COVID as well. So the first thing is that is no excuse not to acknowledge uncertainty. I think we have an ethical duty to say what we know and what we don't know. But and I think you should be unapologetic about your uncertainty. You also should be unapologetic about saying what you do know, what there is consensus about, what there is general agreement about in the science. And I'm sure people who've got bored with me saying this is about what John Krebs, when it's in our, I don't think it's out yet, the podcast that, can't remember. I think it's in the podcast we've done on where we feature John Krebs, when he was head of the Food Standards Agency, and he was faced with disaster after disaster, sort of, scrapie and sheep, and in every problem that you could ever imagine. And he just had a policy for, when you're communicating, you say what you know. You absolutely start, we know this, we are confident about this, and then you say what you don't know. You have that humility to say what you don't know, and then you say what you're doing about it, what you're doing to find out and reduce, improve your knowledge. And then you say what people can do, you give them self-efficacy. And then you say, and this has been, Chris Whitty has tried to do this, but others haven't. Then you say you will come back to people and the advice will change. It's not a U-turn. You say, as we learn more, we will be changing what we say. And you say right from the start that we will be changing what we say. And Chris Whitty, when he started off back in March, standing up there with Boris and Patrick, I was ticking them off. Chris was great. He was just going through these very well indeed. But not everybody is so good at establishing that I think, credibility and that trustworthy communication. There always will be people who try to weaponize uncertainty. But I do think that if it's accompanied by absolute confidence about what we do know and what is important, then and actually accompanied by just data and facts. And that's why I put up those statistics that coming out of ONS and Public Health England, which I value far more in terms of convincing arguments than I do projections and scenarios and worst case scenarios and things like that. Because actually you can't argue with them. That's it.
Now, I've got several good questions about interpreting statistics and about communicating statistics, but I actually wanted to slightly change gear and ask you a question about gathering and using statistics. This is from Rachel Williams, and she says, how can real-world health data recorded in GP practices and hospitals be better utilized for public health purposes?
Oh my God, that's a big question. Oh yeah, no, absolutely.
Question as well, but
yeah, it's such a good question. But and I'm not really the right person to answer that, except to say yes. Obviously, we live in the age of data. There's a huge amount of data now being collected, but health. Information systems have been notoriously poor, appallingly joined up. The fact that the hospitals and the GP practice can't even speak to each other most of the time. And it has been a disaster, essentially. And yet the NHS should be this fantastic resource for learning from data. But it's getting better. It's improving all the time. There's some wonderful analyses that have been done during the COVID crisis by two different teams, the Open Safely team and then Julia Hippersley-Cox team in Oxford, analysing GP practice data involving sort of 11 million patients in one group, 17 million patients in another, and analysing what's happened to them with COVID. Extraordinary power that we've got in this country that is the envy of the world, and we can make even more of it. But it is a problem. Not enough has been done. But all I can say is we're moving in the right direction. And there is some, I would refer particularly to Ben Goldacre's Open Safely team in Oxford, who are really pushing this very well.
Yeah, it is remarkable stuff. I mean, this is something that economists are wrestling with as well. You start with these very well-behaved data sets that are specifically gathered by statisticians for statisticians, and that's all great. But then to go, well, hang on a minute, we've got all this data that's being just sort of scraped together because people are just trying to run the NHS, or they're running the Visa card network, and there's a lot we can learn.
Yeah, but again, I would say this, wouldn't I? But the Office for National Statistics has got a huge program now in accessing that kind of routine data, making rapid use of it, and are doing that already. They've been doing it throughout the crisis and in background for economic statistics. And that is a complete project that's going to grow and grow to make use of this routine data. But you're right, it's a mess quite often. It is messy. It's not nice little rectangular spreadsheets that we know and love. But it is necessary to get that data on the desks as attractive dashboards for decision makers everywhere, and to feed it back to the public. Again, we're the Public Health England dashboard being updated every day, and so many people looking at that, I think just demonstrates what can be done and in a crisis, and that this is such a wonderful example of the kind of transparency we should be expecting from now on.
Mike Hill asks, what are the key factors that we should consider when we, the public, are being presented statistics during the COVID crisis?
Oh, well, Tim, you should be asking this. You've got a whole book on this about what questions to ask. But I mean, you've got a nice thing about, look at the emotional impact. And, your first thing you've got in your book is to say, well, the first thing is do is how does it make me feel? Which I think is brilliant. My own personal attitude is I sniff it. You got to sniff the data. Is it fishy? Is it a bit smelly, what's being claimed? And that requires some skill and background. But what it essentially means, I think the first thing is look at what's the source of the information. Why am I hearing this? What is this? People who are telling me this. Why are they choosing to let me know this data? And what do they want me to feel? Are they manipulating me, or are they genuinely informing me so I can make a better decision for myself? Or are they trying to persuade me of something? So the very first thing I look for is the motivation of the data provider, even before I look at the data. And I think it's incredibly important. Again, something that our group in Cambridge spent a lot of time, our whole centre has got, our little tagline is to inform and not persuade. You know, it sounds a bit pompous, but actually I think it's a very important principle when so much information is given out in order to manipulate you, to try to change your behavior or your feelings or whatever. So I would look, my very first question is look at the motivation of the data provider.
Yeah. Sorry, I wasn't speaking of motivations. I wasn't looking to give you an excuse to mention.
No.
It was actually the number one question that people had voted up. So
yeah, okay.
So anyway, just to clarify, there's no conflict of interest.
But I could then, you know, like you do in your book, you know, I've got in my book as well, you know, a list of you know, subsidiary things you can look at about. Then you start looking at the quality of the design and all that kind of stuff. But I really go back to this idea of trustworthiness. You know, is the claim, the final claim that's being made, if a claim is being made, how trustworthy is that? You know, is it actually justified by the data that's being presented? But again, one of the most difficult things of all that I have to ask myself all the time when I'm seeing a scientific paper or a claim or reading a skeptic's blog or something, I always think, what am I not being told? What data is being cherry picked to show me in order to produce this argument? What am I not seeing? And of course, that is one of the most difficult things to decide. It's like what the dog that didn't bark in the night, because you're not criticizing what's in front of you, you're criticizing what isn't in front of you. And this is a real challenge.
Although it often is possible to tell whether someone is trying to persuade you of something or not, and that's, I mean, when you're sniffing the data, is everything pointing in the same direction, or is it messier? Because if it's messier, then I'm immediately thinking, well, this is slightly more trustworthy.
Yeah.
So look, we've all had a sort of crash course in statistics over the last year. That's been one of very few joys that 2020 has presented us. Do you think that the public's familiarity with graphs and percentages and case counts, and is that going to continue when this is all behind us?
Oh, I do hope so. As it might be, you know, the one, you know, benefit from this whole crisis is people realizing the need to understand what's being communicated, and the need to be able to critique that, and to demand that trustworthy and transparent and balanced information is provided to them. Because as I said, you know, this is, you know, we're in a state where we all, you know, general cooperation is absolutely essential in the context, in the way we're living at the moment. And so I hope that this increases people's you know, feeling of what should be given to them, and I hope it would improve their you know, sense of just wanting to know more. You know, maybe they should try to understand what exponential growth means, well, all these things. Maybe this could be important. I mean, I don't know. I mean, we both sold a lot of books during this crisis. I don't know how related that is, but you know, again, I think that does demonstrate a lot of interest in this area. So you know, if one good thing comes out of it, maybe that is.
Yeah, I would have sold more books if they didn't keep closing the bookshops. But you know, there is. I suppose they have their reasons for doing that. And look, one final question, David. So there is this engagement. We want it to continue. And so what should statisticians like you, nerds like me, what should we be doing to try to keep that engagement going? Yeah, that's tricky. It shouldn't be, you know, just us getting out there and talking to the public. I think, you know, to my profession, I say, and we're you know, really trying to do this as much as possible, that, you know, more statisticians have to be involved in engaged with public communication, whether it's working with people who are doing the communication, you know, or whether it's doing it themselves. And, you know, you have to do what suits your personality and your interest. But I think it's absolutely essential that essentially non-aligned groups
who don't want to argue, who aren't advocates for a particular policy, but just want people to understand better, should have should push themselves up a bit more above the parapet. It's, can be unpleasant at times, but I think it is a very worthwhile thing to do. And it's very unfortunate that so many scientists, either during the crisis, either don't want to do it or can't do it because of the nature of the work they're doing. I have argued that, when you've got a group of researchers working, someone should be nominated and trained to get up there and get out there on More or Less and Today Programme and Jeremy Vine and play. I love Jeremy Vine. It's my favourite gig, going on Jeremy Vine. Should be out there describing their work, and that's their role in the team to a large extent. And I really think that is an important feature. And of course, I would say Office for National Statistics has been doing that very well. They have been out there on Jeremy Vine and putting people up there, not just the head, but other people at different levels, actually talking about statistics.
And I know one of the things that happens, David, is when you get a name, the media always come calling for you. And I know that you have been very actively trying to mentor other scientists and younger statisticians. So thank you for that. And thank you everyone for listening. More information about other Royal Society events is available in the show notes on the website. There's an evaluation survey. You can tell us how wonderful you thought David was in the YouTube description. Please do that, because Royal Society administrators who've worked incredibly hard to put this event on are, they'll be out on the streets before Christmas if you don't fill in that form. So please do that. And most importantly, thanks for listening. Thanks for giving us your attention. And thank you and congratulations to the very wonderful Professor Sir David Spiegelhalter. Thanks a lot and good night.
Thank you and good night. Thanks, Tim. Thank you for the questions.